Hello, everyone, and welcome to our show. All right, and today is all about direct primary care. You probably listening like, what? I've been hearing about it, but I don't know what's going on. Have no fear. We're going to go about it right here. All righty. So before we go any further into today's show, I want to talk to you guys about our upcoming masterclass that's going on. We're having it on February the 23rd. It is at 6:30 Central, 7:30 p.m. Eastern Time. So if you have a team, if you're an organization and your team is just stressed out, right? They are just on the edge, on the verge, productivity is getting low. Have no fear. Just come to our masterclass where we're going to show you 7 ways to use self-care to boost your team's productivity, right? 7 ways to use self-care to boost your team productivity. So we'll see you on February the 23rd, 6:30 Central and 7:30 p.m. Eastern Standard Time. Alrighty, so today I am about to bring my girl on. So this is one of my favorite people. She is so cool, and she's going to give us all this great info. But let me just bring her in on our wonderful fashion, right? We don't just throw people in. You know how we do here. So my wonderful sister Doc here is a graduate of the University of Pennsylvania School of Medicine. She did her residency in Penn Family Medicine. She also did internship down at Morehouse. So shout out to all the Morehouse people. Yes, Morehouse School of Medicine, ATL there. And all my Philly people, she is one of yours. She is the owner of Fountain Medical Associates, which is a hybrid direct primary care practice that specializes in the care of the whole person, right? From childhood to adulthood. She is the president of the Medical Society of Eastern Pennsylvania, which is the Greater Philadelphia chapter of the National Medical Association. That is the NMA. So the NMA is the nation's oldest and largest association for Black physicians. And this is also the day after National Black Woman Physicians Day. I mean, how many ways can we just bring on this wonderful woman right here? She is here to tell us all about revolutionizing medicine and the rise of direct primary care. I'm talking about the one and only Dr. Safia Shabazz. How are you? How are
I'm
you?
doing great. I feel like I should be popping champagne like I won a championship game,
Yes, ma'am. You should. Yes,
which
ma'am.
we are going to do on Sunday, by
Absolutely.
the way.
Absolutely. So welcome to the show. You are doing so many amazing things. But before we get to where we are right now, we have some people saying hello to you. You guys, let's give the shout out, get the shout outs going. Hello. Yes,
Me
Dr.
here.
Una is saying hello. We got the wonderful Dr. Sharita Gaskins also saying hello. All this love coming from all over the US. But I want to bring it back to the Philly chick, right? The Philly
Yeah,
Sophia. Before you
Billy John.
became Dr. Sophia Shabazz, you were Sophia. So, what part of this journey did you decide, you know what, I want to go into medicine? Tell us about it.
It's funny because I've always been interested in the sciences. I
Mhm,
participated in, I guess it's an exposure program, and it really was for engineering. So my undergraduate degree is in chemical engineering, and
mhm.
but I must say that I chose chemical engineering because I knew that I was undecided about the path that I wanted to take forward, and it represented like options. And
Mhm.
while you're figuring it out, I'm sure you can, make pretty good money while you away what exactly you're going to be doing. But
Mhm,
most of my experience with healthcare, unlike many of my medical colleagues, was as the family member of a patient. I
mm,
had most of my exposure dealing with the healthcare system because my mother, she was diagnosed with CML leukemia at age 32,
mm,
and my father had diabetes, eventually developed congestive heart failure. And that was really my exposure to medicine. And so after I graduated from undergrad, I was like, whew, I'm never going to school for another thing. But I would tell myself,
I am laughing at that. You went from that to the career that never
you
stops
never stop.
schooling.
Exactly. And I tell people I tried to do other things.
Hmm.
I had, a nice job. I would find myself in the company library reading medical journals and things like that. And after probably about 6 months, I was like, you know what? I think I'm going to go to medical school.
Hmm.
I'm going to take
This
the
is right.
MCAT, and that's what I did. And I really couldn't have projected that I would choose a career in family medicine.
Hmm.
But being the practical person that I am, it just made a lot of sense to me that if I
Hmm.
really wanted to help people to improve their health and live a longer, healthier life, that the opportunity to do that is in primary care.
Hmm.
Before you need a cardiologist. At first, I was going to be a dermatologist because I was working in skincare at
Hmm.
a major healthcare company. And then I said, or maybe cardiology. I mean, chemical engineering is fluid mechanics. We did a lot of
Yes, that's you, flow all these. See,
exactly. I
yes.
probably figured that out. But I really landed on family medicine. One, because I, don't want to narrow myself down. It's sort of like emergency medicine people. They kind of, many of them were on a verge between family medicine and emergency medicine because you like the
Yes,
ball
ma'am.
thing and people that tended to enjoy the procedures more and, not necessarily like the whole longitudinal thing, went more in
Hmm.
the emergency medicine route. But it's the same mindset. Like I love knowing about a lot of
Hmm.
different things and honestly being of service to so many different types of people. So that's kind of how I ended up in that, and probably being a patient too. When I was a medical
Hmm.
student, I was a patient of Penn Family Care. It was a new department, a
Oh,
new
wow.
program, and I enjoyed the experience as a patient that my whole family could get their care there. My infant son, I had a baby in med school. I don't know why. Why do I
Hmm.
make things hard on myself? I don't know. But my infant son, my then husband, and
Hmm.
we all were able to get our health care at the same place, and I thought that was pretty cool. So
Oh, wow. So this is interesting because you said while in medical school, you got exposed to family medicine at that Penn Family Care. So fast forward now, after your training, you actually went back to that same
yep.
place and you provide care and you're also like helping those who are coming up. So you're essentially like a revolving giving
I
back to the
I
society.
try. I try.
Wow. Okay. So now you're there, primary care, and you're there as a physician. But then there's this new sector of primary care that's coming out, and a lot of people have not heard about it. And, they're saying direct primary care. But what is the difference between direct and like, am I getting indirect care? Am I like,
Right.
so now let's really bring them abreast to what direct primary care is.
And, if you have had trouble trying to figure out what direct
Mm-hmm.
primary care is, I'm right with you because I'd heard
Mm-hmm.
about it for a couple of years through the American Academy of Family Physicians, and I could not figure out what it
Mm-hmm.
was and what they were talking about. I might have even started my practice in that style when I started back in 2010, if I understood what it was.
Right, had you not
So the direct
realized.
part, right? The
Mhm,
direct part has to do with who is who you're contracted with in terms of the payment. So most of us are accustomed to getting our healthcare in what is called a third
mhm,
party payer
mhm,
system. That means that you think your doctor is really beholden to you primarily as the patient, that doctor patient relationship is really got top billing, but you're not the person paying for the service. So if what you want conflicts with what the person wants or what the entity wants that is paying for the service, now that doesn't always mix. So the direct
mhm,
primary care means my relationship is directly with the patient. It's an agreement or a contract between me and the patient that's there in my in-person or virtual exam room. So that's what direct primary care is. So there's different variations of it. So
Mm-hmm.
some people, it's like a monthly fee that you
Mm-hmm.
pay for the service, or in my case, an annual fee that people can put on a payment plan.
Mm-hmm.
Um, but it's actually so much more affordable than most people realize. Like when you say, oh, well, you, my practice has changed. I don't take commercial insurance anymore, but you pay an annual fee. They're like, I can't afford that. And I'm thinking, you haven't even asked what it costs. And then when I tell people, they're like, oh,
Oh.
that's all. Sure, some people would say, sure, I could do that, or other people might
Mm-hmm.
say, no, I can't. But what we found is that for those people who value the relationship, and that
Mm-hmm.
is that is really what I have to offer, that special relationship between me and my patient. Now, there might be some people where they value the convenience factor, or they value the um, savings factor. So they
Right.
might prefer to go to an urgent care whenever they
Mm-hmm.
have a problem, because they just want to be able to go whenever, pop in at 9 p.m., and that fits a certain niche.
Mm-hmm.
Or so I fit the niche of people who really value their healthcare in a
Mm-hmm.
way that they want to be able to invest in it. Now mine is hybrid,
Mm-hmm.
because I'm a bleeding heart person also. And I still do want to find a way to balance between those people who really do rely on government programs for their
Mm-hmm.
health care. And I've narrowed it down to those, government plans or managed Medicaid or Medicare, where we have a pretty good working relationship. Um,
Mm-hmm.
but ultimately, that is really so that I can have some balance between people who really don't have another way, and I want
Mm-hmm.
to be available for them. But for the most of us are making some choices.
Right.
You could not go get your $5 latte every day, and you know
Mm-hmm.
that's one option. Or most of us are making choices. So then all of us are. Setting our priorities. So it's a great fit
Absolutely.
for people who
Absolutely.
prioritize health.
And the challenge that occurs, that those who are not aware of, like you said, the third party entity in the insurance game, is that when you as the physician are trying to make some of the decision and the care for the patient, you are being told what you can and cannot do.
Right.
And that's the challenge that occurs with, the third party, when that's you're hearing, well, it doesn't cover this, that's what's going on. That's what that means. Like when your physician is saying, well, I want you to get this particular medication, we've shown that it helps and it has a better efficacy, which basically means it helps and it's a better
Hmm.
results than medication B. And you go to the pharmacy and the pharmacy says, well, it's not covered.
It's not covered.
That's
Or
that's the
even the
third
labs. I
party
love it when
entity.
you go to the lab and the staff at the lab says, your doctor put the wrong code. I hate that. It's like, I didn't put the wrong code. That's the right code. Your insurance doesn't want to pay for it.
Your insurance doesn't, right. So that's the third party entity. When that other person is making the decision, and the decision is not being made by you nor your physician, there's a third person making the
Right.
decision.
But
So
there's an aspect that's even worse, right?
ooh.
I'm the patient. I don't
Mm-hmm.
want to take a statin.
Mm-hmm.
I'm like, you really should. It could lower your risk of heart disease. And they're like, no, I don't want to. I know I have diabetes. I know that's recommended. I don't want to do that. Your doctor is going to get dinged, which really ultimately it results in like a financial penalty to your doctor because you don't want to take a statin.
Right. So you see that there's a loss of control with the two party. There's somebody else out there that's controlling, and neither you nor your doctor are any of that person.
Right. Exactly. The person that's in control is not in the
Is
room.
not in the room with you with that visit that you've had. So now with the direct primary care, it allows an option for you and for your doctor to sit there and for both of you guys to decide together
Right.
on the plan, on the medication, on the things. So there's also an additional benefits of having a direct primary care, where a lot of physicians are entering into this style of practice because it's real, like you said, you're a bleeding heart. There's this other benefit that you have not talked about yet, which is the time with your patient. So go ahead and tell them about that.
Right. So by having this direct relationship, the idea is that you really don't need to have a panel of thousands of patients like a typical family doc has, but you can really extend the time that you spend with that individual
Mm-hmm.
patient. And so my direct primary care patients have longer visits. They have access to basically like text me through a secure messaging app when they need to or have a question. We do what we can to respond or
Mm-hmm.
get people on a schedule if they really need to come on. So much of what we do is cognitive, and is based on the experience that we have dealing with thousands of people or thousands of visits who might have had a very similar complaint as yours, where sometimes,
Mm-hmm.
in the first two lines we like know exactly what's going on and what to
Mm-hmm.
do. But in a traditional system, if you don't have a visit that I can bill your insurance for, then, we have to create some type of encounter that
Mm-hmm.
the insurance companies say is valid for answering, for providing that expertise. So it is convenient in that way. So yeah, you get more time, more access, and that is part of the value. So like if you had a friend, and I have lots of friends who text me their medical thing, and I'm like, okay, I do this for a living, right? And you're texting me for my expertise. Um, but imagine that you had a friend who you could
Mm-hmm.
text for their expertise. And that is another one of the advantages of direct primary care.
Okay, so someone has a question in the chat. It's saying Facebook user, so I cannot give you credit for the person who's asking this question. Who says, as a DPC, how do you get around getting the patient's insurance to approve certain procedures? I know I will pay for your direct service, but it may be costly to self pay for tests or procedures you deem necessary. So that's a good question.
That is a
So,
good question. And
mhm,
for we have really not, for people who have, and most of our DPT patients do have commercial insurance.
mhm,
And so we order the test in the lab. We don't actually run the test in-house. So like a Quest, we have a discount arrangement for people that don't have insurance, but Quest
mhm,
is going to bill your insurance.
mhm,
Um, if I imagine if it was a type of surgical procedure is something like that, that might be a little bit more tricky. But if I order a medication and you have pharmacy benefit, then your insurance covers it. Or if I order,
mhm,
an imaging study, where the difficulty comes in is for those people who are in a managed care organization. So an
mhm,
HMO plan where any not lab test, but like any type of x-ray or imaging study or specialty visit, they want a referral, which is more than a doctor's order. I could provide a doctor's order, but they want your
mhm,
in-network doctor to go into a computer system and go through an administrative task of saying, yes, I did in fact want this person to have this thing, and I think they need it. And so it's like an extra step that would make it difficult for someone who is in an HMO plan to respond to the recommendations of
mhm,
their DPC doctor if they have to then go through the gatekeeper method of someone
mhm.
who's contracted with the insurance to really say, do you really need this? But they would make your HMO doctor do that too. Like your doctor could write an order and say this person needs this, and then they still have to go on the computer and do some extra little busy work to say, yeah, they really need it. Like I wasn't joking. So it's
It's similar.
weird system, yeah.
Yeah, and I think that there are labs out there there to help with discounted rates for
And you'd be
those who
surprised
don't.
how much it's like so much cheaper if you're not dealing with insurance. Like
Mm-hmm.
you could get, you know, an A1C done for $10, where if you went through your insurance, it's might be 50 something dollars or something
Yes.
really ridiculous, where the real cost of these things is being exaggerated and inflated, and it becomes ballooned because each the insurance companies, you know that they're not going to actually pay you what you charge, so then you'll just double or triple the charge so that you get a reasonable amount
Um,
reimbursed in the end. You
it's
know that.
kind of like literally going to the market. So you want this tomato, and the person who's selling the tomato, they will they want, or they're selling the tomato, so they're gonna jack up the price of the
Right.
tomato.
50% off.
50% off. Yes,
Right.
yes, so that they could get a certain price. So it's similar when you're getting some of these labs or some of these tests
Mhm.
out of pocket, and you're paying the facility itself directly, the cost goes down some.
Right.
When you're using it through the insurance, it's this
And that's the same
astronomical
as
price.
the cost with me. Like the cheapest thing in the healthcare system is primary care. So
Mm-hmm.
if someone is paying $1,200 a year to have unlimited access to me as a primary care physician, it sounds like a lot, but I some people might be paying $1,200 a month on
Yes,
insurance. Now,
yes.
granted, you need something because if you go into the hospital, or you have some catastrophe happen where the hospital care is really expensive. People don't go into bankruptcy about their primary care. Generally, it's because they had an unexpected expense that really require like super
Mhm.
high technology, super high costs of hospital care. So yeah, you need that, but most people have most of their needs taken care of in a primary care setting if they have access
Absolutely.
to it.
Absolutely, absolutely. So now here's the other thing too. When we talk about primary care, a lot of people are still, for us in medicine, it makes sense. We understand why primary care is so important. But for I still have a lot of patients,
Mhm.
and like for those who are watching, you might not know me, I'm an emergency medicine physician. And I still have a lot of patients who don't go to their primary care to get their annual checkup and get their
Mhm.
annual testing, get their annual labs done. And then they come in, and then things are just like off, and you ask them, well, when was the last time you had this check? And then you get this, when was such and such born again? Was that was it
Right.
13? Like 13 years? I think 13 years ago. And you were
But
like, well,
people don't understand too. So
all
like
right,
I'll
so
have
let's
patients
explain.
like, I had a pap test in the emergency room, and I'm like, I am certain you did
No,
not.
no, you did not. No, you did not. We
I'm
might have
certain
been
you
looking
did
for
not.
something specific, but it was
Right.
not a pap test. All right, so go
Right.
ahead and explain.
So, and I think there's so many layers to this, right? One of
Hmm.
them honestly is a numbers game. There are not enough primary care physicians, and that's been one of the challenges I've run into, even as I am um, making this change in this last year to my practice and being a hybrid
Hmm.
direct primary care, where two of the physicians nearby retired. So now all of a
Oh.
sudden, there's a whole neighborhood of people, particularly those of my patients who really value having a physician who is very much like them in terms of their ethnic background. I'm
Hmm.
Black girl from Philly, and here in Philadelphia has one of the largest Black Muslim communities in the country, and that is something that a lot of people value. And there's not that many. I think that I only know of one other,
Mm.
Black Muslim primary care physician in Philadelphia, and she happens to be an engineer too. We both were pen engineers. Yep. But it can be really hard to come by.
Yeah.
And so there's just not enough people That's one. So then that leads to an excess problem. So you
Mhm.
might need an appointment right away, or you work all day and you need an appointment at 7 p.m. And even as a DPC, physician, I can respond to a message at 7 p.m., but I'm probably not going to meet you at my office at 7.
Mhm.
And so people might go to the emergency room or urgent care for that reason, for the convenience factor. So, there's
Absolutely.
different things that meet different people's needs. Um,
Mhm.
but a lot of people, like, honestly, I don't remember having a primary care physician when I was growing up. I really don't. Like,
So the mindset is still to try to get people to understand, especially during some of those years. I think during the early years, your parents took you to the doctor, so that's that. Then you went off to college. Then you're in your early 20s, and it's just like, I'm good.
right,
But then end up to your 30s and you're still not thinking about it, because of course we all think we're forever young, and
right.
then you're getting out to your 40s and it's been years,
Right. But
but
then
things have changed.
there are even some children that are not getting primary care. Like,
Oh.
being in the community that I'm in, it's like it's a unique niche. I have a lot of families that choose not to vaccinate their children. They have other healthcare needs, but they might have gotten thrown out of the
Mm,
pediatrics practice where they were. And so they're not getting any care. So for me, I'm like, no, they need their asthma taken care of. I've had
yes.
babies come to me. I'm like, oh, wow, this baby's really anemic. They still need care. So that's like another dynamic that's happening that I still would attribute that to, honestly, like
Mm,
poor quality programs with insurance companies. But, there's a lot of different reasons why people are not actually accessing care that theoretically they could. If they have a
mhm,
health card, even like a Medicaid card, maybe they could, but there's something happening in a relationship that is breaking
mhm.
down also.
This population that is not aware, you exist. There are others like me that exist. So this direct primary care system in this model, it's not just unique to Dr. Sophia
No.
Shabazz from Philly. There, there are doctors who are all throughout here in the US, and also one of our colleagues. She's doing a direct specialty service in Puerto Rico. She's doing a pediatric endocrinology specialty service. So there are other doctors that out there that exist in this model that you
Mhm.
can get access to the care. So it's, would behoove the person to just think about, like, okay, I know that I have the traditional, um, well, now traditional mindset of how I can get access of care for me and for my family. But there are a lot of doctors out there who are choosing to provide access in a broader sense to
Mhm.
help you out. So, look around. And is there like a list somewhere, or are some of the doctors on a list, like a direct primary care list that you can look
They
around and
do
find?
have such a service. Oh gosh, I think it's DPC Frontier, but I'm not
Mm-hmm.
100% sure. But I don't think that includes specialty care. I'm not sure if that
Mm-hmm.
includes specialty care. A lot of people are much more familiar with the term concierge medicine. And I
Ah.
don't really like to use that term because I don't think it accurately describes what I do, or the way I
Mm-hmm.
do it, but it is a term people are more familiar with, that, okay, this is not going through your insurance. So, but if people were searching for concierge, that might be a way that they could um, access those services where, whether, because we have another colleague, classmate, who has a
Mm-hmm.
specialty care in pain management, that is direct or concierge. um,
Yes.
Rheumatologic, we've got our
Yeah, we have
AMG.
rheumatology.
um,
So yeah, and a couple pediatric endocrinology too, because
mhm,
I know that as we're describing, and even someone in the chat has been asking about, well, what about if I need specialty services? And
mhm.
we also have someone who's a direct surgical specialty. I mean,
Right.
rest assured, she's over in California, but
The GI
so
doctor up the street. So that is
yeah,
growing. Mhm.
yeah, growing in that they're providing additional access, additional ways for you to get great care, but like more time with the physician. So the 15-minute rushed visits, that's been reduced a lot, so you can
Hmm.
get a little bit more time. They can explain, you come up with a plan that you can work together
Right.
on this plan, and you get more access to your physicians based on the way that that physician is modeling their particular office.
And
So go ahead.
well, I would also add that I I think that the least ideal situation is where you don't have any type of health insurance, and this really is your only that you're paying out of pocket for each and every healthcare expense.
Hmm.
That's the least ideal way to do it. Now, you might not need a Cadillac plan where you're paying a super high premium, like you're prepaying this high amount in advance to the insurance company in the hopes that they are giving a fair amount to the doctors that you want to make an appointment with. That's an assumption that might not be true. So people should have some type of insurance that is buffering the cost
Hmm.
when they need to access higher cost services. But
Absolutely.
the physician's time isn't really usually what is running that bill
Hmm.
up. It's the technology. It's the
Yeah.
technology or the testing or the hospital based services. So you
Hmm.
might find that, and I even had this situation happen in my practice. I have to give this one anecdote and I'll try to be quick.
Hmm.
I have a patient who works in healthcare, was working as a contractor, did not have health insurance.
Hmm.
I just listening to her history, I knew she was extremely anemic. I didn't know her hemoglobin would be below 5. Now,
Oh.
if she had health insurance,
So, well, let's give the context for those who don't understand the hemoglobin below 4. The average female's hemoglobin, we're looking, should be at least 13. Let's just
right,
say that.
12,
So she's at
13, 14.
5.
She's
So,
at 5, 4.8. And, I
mm,
normally would send this person to the emergency room because
mm-hmm.
it's the least liability for me, the quickest thing. But I'm like, okay, she's walking around like this. She's had to have been like
Her
this for a long
body's
time. Like, honestly,
compensated.
it really is not an emergency. But if
Hmm.
I send her to the emergency room, they'll get it all squared away. And I'm sure to the
Hmm.
tune of thousands of dollars. I
Absolutely.
called a local hematologist. I'm like, hey, I have this patient. What would be your cash price to do an iron infusion? Blah, blah, blah. It still was like at least $2,000 by the time
Hmm.
they had. So I went online to order the supplies for the iron infusion. And I said, I really hadn't been very experienced setting up an IV line. I've ordered lots of them, but I hadn't actually like set up all the tubing and all of that myself. But
Hmm.
they work in healthcare. We figured that out. And for $150,
Wow.
I was able to provide the iron infusion, feeling better like within 2 days. Came back for another
Wow.
iron infusion where we were able to solve that patient's problem for a fraction of the cost.
Uh, wow.
Yeah. So
Wow.
yeah, I thought about I
Wow.
but that but in if I had spoken to the doctor, they might have understood, but the staff was like, they were having a really difficult time understanding the concept. They're like, well, we would charge as little as what we get from, this
Hmm.
XYZ insurance company. I'm like, but you don't even have to send it out and hope you get it later. Like, she's going to
She'd
pay
pay you
when she gets
immediately.
there. The time value of money was like completely lost. Um,
Hmm.
all of that. But I'm like, you know what? Guess what? I was able to get a whole box. I have extra doses right here of the medicine because the whole entire box of many vials was $500. I only used 4 of them for her, and I've got plenty left over. And so they were going to charge her like 800 something dollars for each one plus the visit and this. So a lot of things are
Wow.
being inflated where, you
Where
know,
you can come. Wow. So, okay, anyone who's anemic and you're in Philadelphia and you have a direct primary care physician right there with you who can help you. Wow.
yeah,
Wow,
yeah,
wow, wow. But that also shows the value of when you can make the decisions yourself, and
Right.
how when you cut out that intermediary person, you can make the decisions, you can create like you said, the cost value for money, the time, and you've helped that young lady. I mean, as much as she's walking around with that 4.8, which I've seen it, um she was probably so fatigued, but still going
Right.
through life because she had
Right.
no choice. I still have things to do. I'm tired, but I need to just get up and still get it done. And then now
Mhm.
you've given her this way that she can get her iron levels back up, her blood
Right.
levels now going to go back up, her energy. As much as she
Mhm.
was doing with a 4.8, I cannot imagine
Right.
when her
Now,
hemoglobin
okay.
goes back up to
e-
8, 9, and 10.
Exactly. Now, if she needs surgery, I mean, that's going to be tough to pay for
Absolutely.
surgery out of pocket. Um,
Hmm.
but there are
And the
people who
other thing
even
too,
will
they
go
wouldn't
to
even
another
give her
country.
surgery until they transfuse her. So she
Right.
would still need
True.
transfusion. Wow.
That's very true. And they have like a whole medical tourism now. Everybody thinks it's just for the BBLs, but I remember watching a special where a self-insured company was sending their employees to another country to have hip replacements or, you know, gastric bypass surgery, medical procedures they really needed because the cost was so much less than
Hmm.
the way we do things here. It's like the system. And they do have, there is it's not in my area, but they have it's like a surgical center. I don't know if it's just orthopedics, but that is what their specialty is people who are paying out of pocket for certain surgical procedures. Now, I forget what that group is, but
Mm.
I know it's at least orthopedics because there are many people in this situation, entrepreneurs or
Yes.
um,
That's
uh,
what I thought about
Mhm.
for your care. Small business owners, you own a business, you have employees,
Right,
you wanted to provide a way to help them to get care,
right,
in value added care in a way that it's costs effective. The
right,
direct primary services and physicians are here, and that's a great way to help small businesses, to help those who, like you said,
right,
if you are there in an, yes, you will need some type of transitional insurance in case you have to do those high ticket items, such as, yes, if you need to go to the cath lab, which means that you have a heart attack, you need to go to
right,
the cath lab. But to do the preventative care, which is what our direct our primary care services does, that you can get it at a lower cost and still get excellent care. So now
right.
here's the thing: it's not like we're saying like, okay, well, we're not going to send you to the top doc. These are still your top doctors who
I
are
mean, I'm
just
all right.
deciding. All right, let me, in case you are just watching, you did not realize she is the president of the National Medical Association, the Philly chapter, right? So you're not just getting some random person off the street. You're getting your top doctors here who have decided that, you know what, we can get you excellent service and we'll work with you directly and then get you services at a great price.
Hmm.
That's exactly what's going on. So when you're seeing this direct primary care services, don't think that, well, this is somebody that couldn't and the insurance didn't want. No, no, no. They
Right,
chose you and you are choosing them.
right.
So that's the Cadillac care that we talk about. All righty. So now, in interest of your time, because I know you do have your services that you're providing to the great city of Philadelphia, which I need to visit again. All my Philly people out there
You
watching,
got to come
hello,
for the
hello.
parade.
Oh, when is the parade?
I'm sure it's going to be next week. After the Super Bowl.
Okay, so all their Philly Eagles people. I used to have to work the Eagles game as I did my training in Philadelphia. For those of you guys watching, yeah, right there, Thomas Jefferson. So worked
That's
at the
where I was
Methodist
born. How about
Hospital.
that?
Yes, so all the Eagles people, good luck with your thing. I will see y'all after the week after, because I know how you Philly people do. So
Yeah,
let's
we
talk
cut up a
about
little bit.
so now let's talk about like how are you and what is Dr. Sophia doing to prevent burnout? Because this is something that's just, what are you doing for your self-care there to really just, keep yourself at your optimal like mind, body, and spirit so that you
Right.
can provide such excellent care to those there in the Philly area.
Well, I recently invested in something for myself that I have told lots of people to do,
Hmm.
but to be honest, the convenience factor for me, I recently signed up with an online therapist.
Oh,
And
nice.
yeah, it's been going great so far. I had to switch once. And so that's one of the things that I only recently started doing for myself that
Hmm.
everybody should do. And there's a lot of great options. I think, in a similar way that I know is the case in primary care with the shortage, it can be really hard to find
Hmm.
someone that you feel like you have a good connection with. So I did that. I'm going to admit to my deficiencies on the exercise front. I have the bike, and I was on it last week, but I haven't gotten on it, haven't gotten on it this week.
Hmm.
Um, and I really do try to devote time to rejuvenate myself
Hmm.
spiritually, religiously, and um, prayer. I've tried meditation. I can't say I'm an expert at it, but all of us are really trying to improve.
Absolutely.
I do believe in taking vacation like some people take medicine. So I think that is actually really important.
Hmm.
I'm learning so much more about the benefits of the sun, and not just like the whole UV vitamin D thing, but near infrared radiation and how important it is to just, whether you have clothes on or not, just go outside. And apparently, the sun's rays can radiate into your body 8 centimeters and like heal you. I'm like,
Oh.
okay, this is why I need to be in the sun more often. Yep.
And really getting some of those rays to do its
Yes.
job. Yes,
Yes.
the sun is there is definitely powerful. One of the ways to really, which is why, why is the sunflower following the sun?
Mm,
Why are the flowers, why are we blooming? It really, like you said, it has its power to heal. And we do know, especially for our minds also, for
right.
those who are without sun and it's dark and dreary, it can really dampen the mood. So having sun rays and a bright light,
Yes.
actually helps, and some of its UV qualities helps us. Alrighty, now here's my fun question of the
Yeah.
day. Alrighty, I asked this to all my guests, but I got to figure out what I need to take off the plate for you. Okay, so
Mhm.
my question is, if you weren't a doctor or an
Hmm.
engineer, and I know you like to do stuff with your skin, so I got to move out dermatology or any of that, what would you be?
Hmm. You know, I am a half-hearted gardener, and I
Ooh.
think I could do like, well, I think I maybe could learn how to be a farmer at some point in time.
A farmer. See, that's the thing about this. You don't even have to learn. It's just whatever it is, because I'm a dancer, and my friends and I were going to be backup dancers for Beyonce, and then with this new ticket price, I think we
Oh,
would do very well.
yeah.
so, so you're
I
a
mean,
farmer.
I have right outside. That's one of the lovely things about my office is I have like a big bright window, and
Mhm,
right behind my office, I've had uh, planting beds. It's not really in season right now, but last
mhm.
year I had tomatoes, some okra. I always try to do my herbs, so I dibble and dabble a little bit. And I
Oh.
really do think fresh food is the basis of health, but it also is
Mhm.
really therapeutic to watch things grow. So, to take something, we have a rabbit, and the rabbit chewed down my monstera down to the nubs, but it really gave me a lot of joy to like cultivate it back and split it in two and watch it grow. So those aren't
Ah.
plants that I eat. Apparently they're delicious to rabbits. But it is therapeutic to me to watch something grow.
To grow. Wonderful. Yeah, we've had a couple of our doctors who loved and having gardens. One of my colleague whom I grew up with in Jamaica, Dr. Edie Allen, he's one of my first interviewees from back in like 2021.
Wow.
He also says he loves to garden. So yeah, you're in good company. And then we have the wonderful Dr. Jarita Higgins too, that she also has a garden that she uses
Yeah.
to help to teach those within her family practice. She's down in the Maryland area.
Yep.
Yes,
Yep.
yes.
I haven't been inside her clinic, but they had like a sort of like a health fair, and I went down there, and
Oh,
um,
nice.
I love Dr. Jarita.
Yes, absolutely, absolutely. I see Dr. Mary Alice is saying hi. Our dermatologist that we had on last week, she was talking all about the beauty of the rays, but
Hmm.
protecting yourself.
Yeah, you
The
got to
production,
protect yourself.
you got to protect that skin, Dr.
But
Friston.
that's the
So
thing, the near infrared can go through your clothes, so you
yeah,
can,
that's what
just go out
she mentioned.
there.
She mentioned, she says, hey, you're sitting next to that window. You still have to put a sunscreen on. You still have
Mhm.
to put the sunscreen on. Alrighty. So now, we've had this wonderful conversation. We've talked about direct primary care, the benefits of it, all about, like we said, this is a new revolutionary. We're saying the word revolutionary, but some doctors have been doing it for a while. And
Right.
now they're adding this term to direct primary care, which you're getting access to your doctors. You're doing your direct fee to the doctor, no third party. You're getting all the additional time based on the contract that you have with the doctor in that setting. Now, and you also, like, you're mentioning in the Philadelphia area that you have a large population who probably doesn't even recognize that this exists,
Mhm.
and you're a family doctor, so you take care of children and you take care of adults. So
Yeah.
if you have a child who's in the area, you who has a chronic illness such as asthma, which needs to be taken care of preventative wise, and we understand the asthma attack, that's fine.
Mhm.
That's me. I can take care of you with your asthma attack. Maintenance, see what had happened was I didn't do that type of
The
training.
emergency was over.
Emergency's over. I didn't do that training, but we have Dr. Sophia there in the Philly area. So let them know where they can find you so that you can help these children, you can help these families in the area who are not aware that there's a doctor there that can help them with this with their care through
Right.
this model, or that small business owner that's like, well, I got a business, I'm a business owner, I'm an entity of one, a solopreneur, I guess I just can't have insurance, or I
Right.
can't get care. Tell them
Well,
about
they
where they
can
can
find
find
us
you.
online at fountainmedonline.com,
Hmm.
and you can click on the tab for direct primary care for more information about that.
Hmm.
So we are right here in Philly, but I'm also licensed in several other states. I have a virtual direct primary care option. So I serve
Hmm.
patients in Illinois, New York, New Jersey, and Virginia.
Hmm.
And so that is an option. We've gotten people's blood pressure from the 200s for the systolic or top number, gotten that under control, help people get their weight under control, diabetes. There's
Nice.
so much, like I said, that we do that's cognitive. So
Hmm.
it's not exclusive to Philadelphia area, although most of my patients obviously are in Philly.
Oh,
But
say those states again, because so you have
yeah,
Illinois.
so virtual direct primary care. So that
Hmm.
is another option we have, and that's available as of right now to patients in Illinois, New
Illinois,
York,
New
New
York,
Jersey,
New
and
Jersey,
Virginia.
and Virginia. Wow. Did not know this. Look, see, this is why I ask all my people questions, right? This is why I do this. This is why we want to spread the word. So now, for those of you guys who are listening, and you are a small business owner, or you're a patient. Well, you can be a patient of Dr.
Right.
Sophia, and you're living in those states. You have the option of doing this through the virtual primary care options. Love
Yep.
it, love it. So give them that website again.
fountainmedonline.com.
fountainmedonline.com. Alrighty, guys. So I know you enjoyed this as much as I did. This is a wonderful, wonderful way to get introduced to what direct primary care services are, the benefits of it. What are some ways for you to get quality care at a good and affordable price, right? So now, if you were here and you're like, I only got part of this because I had to run, have no fear. You can find this wonderful episode on our website. Just go to yourcaringdocs.com and select podcast. You'll see Dr. Sophia's beautiful face, and you just click listen here, and you'll be able to see, yes, right there. You get to see her beautiful face, and you'll be able to get this podcast episode, right? If you are a doctor and you're doing amazing things inside and outside of clinical medicine, do not forget that you too can be on this podcast, right? So just send us an email at drbeckford@yourcaringdocs.com to book. Just say, hey, I want to be on. I want to be on. Do keep in mind we are booked out a couple months in advance because there's just so many amazing doctors like yourself
And
who
an
are doing.
amazing host.
Thank you. Thank you. You guys are doing fantastic things inside and outside of clinical medicine. If you're just jumping on and you are within an organization, your management, your leadership, and your team is getting low on productivity and they're just stressed out, if your team is on the edge, do not forget that we have a free masterclass that is coming up on the 23rd of this month. This is February 23rd at 6:30 Central PM, and it's 7:30 Eastern Standard Time. And we are talking about 7 ways to use self-care to boost your team's productivity. So we'd love to have you on that. So if you would like to be part of the masterclass, just go to yourcaringdocs.com/masterclass. That's URCARINGDOCS.com/masterclass. And we will see you there. Alrighty, Dr. Sophia, any last words for our people before we head on out?
Well, I would just tell people to prioritize your health, your family's health. And, if you are feeling like you don't have a relationship with a primary care physician, or you have one, but there's just something missing, you feel like they just don't get you, maybe look into a direct primary care practice or direct primary care doctor and see if you can get that old school family doc feel back.
All righty, there you go. And if you are in Philly, which is basically Pennsylvania, because you can do it
Right.
virtually from any. If you're out in, yeah, exactly. Go to fountainmed.com. If you're in Pennsylvania, New York, Illinois, New Jersey, or the Virginia area, Dr. Sophia is one of the docs for you. All right.
All
Thank
right.
you so much for joining me.
Thank
All righty,
you.
everyone. Thank you guys for joining us on this wonderful, wonderful interview. We will see you guys next time. Bye.
Bye.